On several occasions, patients have raised concerns over the behavior and attitude of nurses and midwives in line with their duty, which in turn affects service delivery.
From the time the nurse reports to the ward, her talk, her speech, and everything about her is about her patient.
Since we are always at work, we are always so busy, so you might face some challenges with dealing with difficult patients.
In lieu of this, Little Winnie Foundation has organized a soft skills in healthcare training to improve service delivery of nurses and midwives towards patients.
So we have told the nurses and midwives to be able to think outside the box, look at things that can be able to help them grow. If there are innovations in different areas that can actually help them to grow.
Little Winnie Foundation has been able to make us realize that we need, no matter how the patient is difficult and no matter how the situation is, you need to work on the patient positively.
This is something that we need to totally put in the training of all the nurses and midwives in the country.
Gracing this training and launch of the training manual was Dr. Nanyonga, Vice Chancellor of Clarke University.
Healthcare systems require more resources we do not have. So we need nurses and doctors and midwives who can innovate and bring new solutions to the table. And that means that they need to think outside of their current scope in their technical skills.
Dr. Nanyonga, however, expressed the need to include soft skills training in the nursing and midwifery curriculum by the Ministry of Education.
The surveys that we have done consistently reveal that patients can be so frustrated with midwives, nurses and doctors. We know that the healthcare system is not as responsive, that there are so many people who are left out. So how do we create an environment that is more inclusive, where every Ugandan, every national of this country is able to access a quality care experience in any healthcare setting, whether private or public?
Nabukeda Winnie, Chief Executive Officer of Little Winnie Foundation, highlights the reasons why she decided to come up with the initiative of training nurses and midwives.
That is looking into training other trailblazers and change makers into health to be soft skills trainers. Partners like Ministry of Education, Uganda Nurses and Midwives Council, Ministry of Health and any other organizations, hospitals, universities and schools should be able to incorporate soft skills into these trainings for young health professionals.
The training, which was attended by over 70 nurses and midwives from different hospitals and health facilities, comes at a time when the country awaits commemoration of the International Midwives Day on 5th May and the International Nurses Day on 15th May this year. Maureen Babide, Deborah Namamonde for UBC News.